Welcome to Variations 4, the respiratory unit. In this video, we'll be covering questions 11 and 12. The topics are SARS and breath sounds. So with SARS, I think the best thing to do is just to look at our concept map. So if you remember SARS a few years back, it was in Toronto. I think that was a major hub of it in terms of Canada. The same thing here, coronavirus. At the time this video is being made, we're dealing with COVID in Vancouver and BC, around the world. And you can read through this map. It's pretty self-explanatory. And the interesting thing is that there are, obviously because it's coronavirus as well, there are many similarities to what we saw then as to what we're seeing now with COVID. Let's give some examples of what I'm talking about. So treatment, at the time this video is being made, we don't have any treatment for it and we don't have any vaccines for it. And that was the same deal back when SARS was around. It's symptom management in terms of the symptoms themselves. Pretty similar stuff here in terms of the fever, the cough, the chills, the respiratory symptoms. Diagnostics, I mean, they're doing the swabs right now for COVID. That wasn't mentioned here for SARS. I'm not sure what they were doing back then, if they did the nasal swabs that we're doing now. Oops. In terms of therapy, the circle here, well, I mean, yes, we've got people on ventilators now with COVID, so similar thing with SARS, although it's at a much greater scale now than it was then. We're testing antivirals at the moment for COVID. We didn't have any for SARS, and we don't have any at present for COVID. The whole hygiene, universal precautions, same deal. We're doing it. Points to note, surgical mask versus N95. In general, walking down the street, being in close quarters with people, you're fine with a surgical mask. You may want to protect your eyes too, in case you get sputum on the eyes or something. But any aerosol producing activities like CPR, like intubation in the ICU, like nebulization on the wards, that produces aerosol, therefore airborne, and you want to be wearing N95s for that. In terms of the rates of improvement, rates of people needing mechanical ventilation, from what I can see, pretty similar then as it was for SARS, as it is now for COVID. You got the vast majority, 80 to 90% of the people who will pass through the COVID as they pass through the SARS, and that'll be the end of it. They'll be fine. You get that 10 to 20% that will need ICU intubation, and some of those will not survive. The big difference that comes to my mind between SARS then and COVID now is that COVID now, the coronavirus we have now, spreads before symptoms show in the initial host, or in the person carrying the COVID. They can spread that disease to other hosts without having any symptoms. I don't remember that being a feature of SARS. Okay, so another map you'll want to go through yourself, you'll want to review the pneumonia map. It's really straightforward given everything we've talked about in this unit, but you'll want to give it a quick read to just keep that in mind. You do not need to know acute respiratory distress syndrome for this course. ARDS, you do not need to know that for this course. It's going a bit too far. Okay, so then the final thing we need to run through is the lung sounds. That's question 12. So before we do that, just a quick note on pulmonary edema, which we've talked about throughout this unit. Here you have your alveoli. Gas can exchange pretty nicely into the bloodstream. O2 in, CO2 out. Very nice. And you've got some fluid starting to fill in here, and that's going to inhibit gas exchange. So the more fluid you get, the more inefficient that gas exchange is. So this is the problem with pulmonary effusions. Here's an interesting chest x-ray. Look, in general, what we're talking about here is nice clear lungs with a lot of fluid in the tissues. The whiteout is like the fluid, the infiltrates, they call it. Okay, and there's moving up here. We're talking about lung sounds is really the purpose of this question. So let's just gonna go here and take one of our examples. Before we get into the grid that's in your questions, let's talk about this picture. So I want you to imagine this is well, you don't have to. This is supposed to be a picture of a pleura filled with air, or we could even say filled with fluid, pushing up against the lung tissue. What do you think you're going to hear on this side? You're not going to hear much at all for a couple of reasons. First of all, the pressure against the lung tissue is not allowing the tissue to expand. So you're not going to hear any air entry. You're not going to hear much at all. Second, if this is fluid pushing up here, you can't hear anything through the fluid, even if there was something going on. Okay. Let's take something a little less extreme. I want you to imagine that maybe the fluid was only up to here. See this line where the air is? Let's just say the fluid was filled up to here. You had some pretty bad pleural effusions up to this level. Okay, you with me? At that level. The rest is all clear up here, but this is fluid here. What are you going to hear? Well, at the top, you can hear whatever's going on up here because the fluid's down here. You can hear right through to the lung. You might hear crackles up here. You might hear wheezing. You might hear air entry. But where the fluid line is and below, you're not going to hear much at all. That's good to keep in mind when you look at these questions. This is a useful grid for studying. And what you want to do is say, look, if I had pleural effusion, why may I or may I not hear crackles? Why may I or may I not hear entry to bases? What circumstances will cause me to hear or not hear these things with pleural effusion? And the answers are noted in these boxes. Same with wheezing. And you can do the same exercise with pulmonary effusion too. So you should read through these yourself, make sure you understand under what circumstances you might or might not hear crackles for each of these, air entry to bases for each of these, and wheezes for each of these.